Hi, I'm Jessica Mathwick Olson, and I am the Director of School-Based Mental Health Services here at Washburn Center for Children. I am a licensed clinical social worker and have been in the field of community mental health for over 20 years now. There really isn't a starting and a stopping point with education and mental health, that they really live and walk parallel with one another. And so we know that when a kiddo is really struggling emotionally and with their mental health, it's going to be really hard to expect them to just block that out and focus on what's going on in the classroom. We know right now that families are extremely overwhelmed and busy and very scheduled, and by providing school-based services in the school where kids are spending so much of their week, we can really help to reduce those barriers and increase access. In addition, it allows us to communicate with those providers that kids spend a lot of time with: teachers, school social workers, counselors, nurses, administrator, paraprofessionals. So we really get to team with those folks on how we can best serve the kiddos and their families. We often talk about the partnership and collaboration, problem solving, celebrating successes, being there in the moment when things may come up from a kiddo that would be different than in a clinic. We wouldn't necessarily have to schedule something. We could help to provide support as needed. A lot of our services at Washburn are really meeting clients where they're at, both physically and emotionally. And that is the same for school-based, since we are co-located in schools. For the continuum of care, it allows us to partner with our other programs at Washburn. And so if we do see that there's some increased symptoms or the risk factor has changed for a kiddo, we can partner with our crisis stabilization program, our intensive in-home program, and work to augment those services and work together. It doesn't necessarily mean that a kiddo has to say goodbye to one provider and hello to another. We'll work very closely on making sure that it's a right fit for the family and the kids. My experience is that belonging really does touch the continuum of ages, and that for our elementary kids it may look a little different, but it's just as important for high school kids to know as well that there's someone in this building that understands me from this perspective. There's someone in this building that I can trust, and there's someone in this building that I can look to for support.